Okay, we are online. I welcome you very heartfully here in Berlin, in the center of the Deutsche Bundestag. It's a great pleasure having you all here, dear ladies and gentlemen, and dear esteemed colleagues. It's a great honor to welcome you all today to the launch of the event of the 2030 Agenda for Sepsis. This event, organized in collaboration with the Global Sepsis Alliance, the Sepsis Stiftung, the Unite Parliamentarians Network for Global Health, and the Virchow Foundation for Global Health, is dedicated to address one of the most pressing global health crises. It's called sepsis. I would like to extend my deepest gratitude to you and your dedication for this critical cause. Sepsis is a major global health threat responsible for immense morbidity and mortality worldwide. The numbers are alarming. According to the WHO, sepsis affects approximately 48.9 million people every year. And tragically, around 11 million of those cases result in death. This represents nearly 20% of all global deaths annually. These statistics underscore the critical importance of the work we are here to launch today. The 2030 Agenda for Sepsis is the first comprehensive global strategy developed by the Global Sepsis Alliance in cooperation with 6 regional sepsis alliances across Africa, Asian Pacific, the Caribbean, the Eastern Mediterranean, Europe, and Latin America. We now have a clear roadmap that emphasizes the need for political leadership, collaboration across borders, investment in health system preparedness, and the strengthening of local and regional capacities in research, development, and production, and medical education. Importantly, it also reminds us of the need for equitable access for the life-saving medical interventions and care. Today, we stand at a pivotal moment. This agenda offers us the opportunity to unite our efforts to reduce the suffering and deaths caused by sepsis and to raise global awareness of this severe condition. I look forward to the discussions ahead and to working together with all of you to develop concrete solutions that will help us to meet the improve global health and sepsis prevention by 2030. Let's take this opportunity to chart a path toward a stronger, sustainable, and more equitable global health agenda. Thank you very much for your attention. And now we have a video by Dr. Tedros, who's the Director General of the WHO, and he is addressing us. It is not live.
Dear colleagues and friends, Guten Tag allerseits. WHO congratulates the Global Sepsis Alliance on the launch of the 2030 Global Agenda for Sepsis. This is a valuable tool in our shared work to prevent the suffering caused by sepsis, which kills 11 million people every year, including children, older people, and other vulnerable groups in low-income countries. The global agenda is well aligned with WHO's work on sepsis. We have made good progress in raising awareness about sepsis, but we can and must do more. Millions of lives can be saved with proven, affordable interventions that are feasible in every context. WHO is supporting countries to improve the prevention, early recognition, and timely treatment of sepsis. We're implementing the Global Action Plan on Infection Prevention and Control. We're developing new guidelines on clinical management, and our sepsis toolkit supports communities and countries to strengthen emergency and critical care, improve outcomes, and save lives. We thank the Global Sepsis Alliance for your close partnership and leadership on this issue, and we're deeply grateful to Germany for its long-standing support. Vielen Dank. We look forward to our continued partnership to reduce the preventable burden of suffering caused by sepsis.
founding president of the Global Sepsis Alliance. Dear Konrad.
Could I have the stick, please? I thought there would be also the words of our Hans Kluge, but they may come later.
Yeah, but we have to turn on the microphone, please.
Yes, so it's indeed a historic day in the global fight against sepsis, and if you can please bring the presentation, and the numbers have been mentioned already, and I don't need to repeat this, that on a global scale, 20% of all deaths worldwide are attributable to sepsis. But it's not only an issue for high-income countries, it's also an issue for high-income countries, but even more so for low- and middle-income countries. And it's a leading cause of preventable death and disability. This has been already mentioned. And it was again and again underpinned by Dr. Tedros that it's a tragedy that most of these deaths are preventable. And the measures have been mentioned. It's prevention of infection, clean care, early recognition, and management of sepsis as an emergency. Next slide, please. And if you look at this graph on the right-hand side, you see what we have achieved, especially in high-income countries. This is data from the US, where in 1900, the crude death mortality rate from infection, which is sepsis, was 800 per 100,000 population. And there was a continuous decrease until 1950-60. It went down to 50 by 100,000 population. It was only interrupted by the Spanish flu, which is depicted here. And the measures that were effective was the establishment of public health, departments of health all over the US, which led to better sanitation, chlorinization of water, development of vaccines, development of antimicrobials. And this confirms it's preventable. The tragedy is, as you have seen from the slide before, that in sub-Saharan Africa and in other parts of Asia, there are still countries where the incidence of sepsis is between 3,000 and 4,000 per population. This means even if the mortality rate is around 30%, this crude mortality rate still applies in this region of the world. And that's why I'm glad that you, as chair of the subcommittee of global health of the Bundestags, are here. But sepsis is also preventable in high-income countries. This is published in the JAMA, and it depicts the decrease of ICU-treated sepsis patients between 2000 and 2012, just not mentioning the word sepsis, just by the implementation of quality assuring measures such as mandatory critical incidents reporting, such as rapid response teams, which mean systemic education of healthcare workers, physicians. If this does not happen in Australian hospitals, they are not credited. And this was effective also in the overall reduction of the incidence of cardiac arrests, etc., and the success in resuscitation. We have been asking for this, and we will continue to ask for this. Sepsis can hit everybody, independent of age, wealth, celebrity, etc. And these are the only recent known people on this scale. But still, sepsis is not known in our population, and it's not handled appropriately on a high priority in most healthcare systems. And it was thanks to the efforts of families who were worldwide, who have not been satisfied and did not accept this, who made really a difference. And we are so grateful for them. And just to reiterate what this means for Europe, if we would have in Europe the same sepsis incidence and the same mortality rate for sepsis, we annually could prevent 680,000 deaths. And if I think back when we launched the European Sepsis Alliance, and that's why we are so grateful to the former Commissioner of Health of the EU Commissions, Dr. Andriukaitis, who here in Berlin, in the embassy, a British embassy, told me, yes, I know what sepsis is because I am a surgeon. And 3 weeks later, we had an appointment with him in Brussels, and he walked his talks, and he was a patron not only for the launch of the alliance, but he still continues. And we are so grateful also to WHO that WHO was willing to meet on our request and on the request of survivors in Belgium, in France, in Sweden, to meet, do the annual Walk the Talk event in Geneva last year. And for me, this is really now, including this meeting here, a breakthrough in the fight against sepsis. And it confirms what cancer people have already recognized in the 50s and 60s, that, and Virchow even recognized before, that the physicians can only make suggestions to the policymakers, and it's up to them to make them happen, because to cover any and to solve any global health threat requires an approach by the whole society. And as you can figure out, in the cancer field, advocates have recognized, all in the 40s and 60s, that a disease can only be transformed scientifically if it can be transformed politically. And they asked rightly for a moonshot against cancer. And they had ad in the New York Times and other journals, Mr. Nixon, you can cure cancer. I only would like to encourage you to join this fight. And thank you for so much, all of you, and there are many in this room, who have supported this fight since 20 years and longer. And we can discuss this later. And now I hand over, not without to Roland as the CEO of the Virchow Foundation. But before I do so, I want also mention here that the difference that we're facing now, that we have a global agenda, is we owe to Dr. Mariam Jashi, who as a former Minister of Health was quite experienced in how to get issues on the global scale, like the successful fight against hepatitis, like the successful fight against HIV and other global health threats. So thank you very much, and we are grateful that prestigious institutions like the Virchow Foundations have joined this fight over the last years. Thank you so much.
Yeah, thank you so much, Honourable Chair, Honourable Members of Bundestag and the Diplomatic Corps, dear Professor Reinhart, dear Dr. Jashi, esteemed speakers and distinguished participants. The burden of sepsis truly is a global one, and one with exorbitant dimensions. And the number associated with this dimension have already been underscored in the opening remarks by Professor Ullmann, Dr. Tedros, and Professor Konrad Reinhart. And for sure, they will reappear during this launch event today, 3 days ahead of the 2024 World Sepsis Day on September 13, under patronage of both the WHO Director General and Federal Minister of Health, Professor Karl Lauterbach. So it was mentioned 48.9 million cases, but I would like to point out more than 40% among them account for children younger than 5 years. And even according to the newest number, the sepsis counts for 13.7 million deaths, which means 1 death almost every 2 seconds, with more than 20% among children under 5 years. Looking to Germany, according to most recent estimates in our country, there are over 500,000 sepsis cases every year, with more than 140,000 deaths, and over 270,000 of the survivors suffer from long-term consequences. At the same time, we must not forget the dramatic individual cases behind these extremely high overall figures, and the testimonials from sepsis survivors that we are about to hear will contribute to this. Dr. Tedros addressed the World Sepsis Congress in April this year, underlining that nobody should die from sepsis, adding that sepsis is mostly preventable through effective infection prevention and control, early diagnosis, and time-sensitive antimicrobial and other therapies. On 29 May 2070, at the 70th World Health Assembly, the WHO resolution improving the prevention, diagnosis, and clinical management of sepsis was adopted. And this was initiated, and it's a tremendous merit, by former Federal Minister of Health Hermann Göhde, together with his colleagues from Switzerland, Austria, and Luxembourg. Since this milestone resolution more than 7 years ago, though only 15 countries have developed national action plans for sepsis and/or evidence-based policies for sepsis. While Germany has undoubtedly made important steps in the fight against sepsis, it still belongs to the countries lacking a national action plan. As it must be observed that there hasn't been a significant change in achieving sepsis competence in the German population throughout the past few years, in terms of awareness building, we need to intensify both high-level political engagement and the joint commitment of all of us. This is also why today's event is absolutely crucial. We celebrate the launch of the 2030 Global Agenda for Sepsis, as the Global Sepsis Alliance emphasizing shaping the first multi-year strategic vision aimed at elevating the significant human, societal, healthcare, and economic burden of sepsis, and its equally through concerted efforts at all levels. And the central core of this agenda is built by 5 strategic pillars, each with overarching goals, specific objectives, priority directions, and interventions, while corresponding gaps are being identified and detailed targets, key performance indicators, and means of verification are being very well elaborated. This agenda truly marks the most significant milestone in the fight against sepsis, as well as one of the most important and effective pathways towards achieving SDG 3, while additionally intertwined closely with many other SDGs, specifically 1, 2, 5, 6, 10, 13, 16, and 17. And overall, and this is a major essence of the agenda, to achieve success in the fight against sepsis, it requires interdisciplinary and multi-sectoral cooperation, especially under a holistic approach and system-based thinking. A holistic approach and system-based thinking, by the way, is exactly what is honored by the International Virchow Prize when it comes to the achievements of this year's laureates, celebrated in October at Rotes Rathaus Berlin. On behalf of the Virchow Foundation and of the GHA German Health Alliance, letter comprising 120 member organizations across sectors devoted to health system strengthening and international cooperation in health, I am pleased to express our unwavering support for the 2030 Global Sepsis Agenda, reiterating that we stand closely together with the Global Sepsis Alliance. How the fight against sepsis needs to be shaped is nothing less than a decisive blueprint towards achieving SDG 3 and SDG 17. We should not believe that we can attain the health-related SDGs if we fail in this particular very exemplary battle. The Global Sepsis Alliance can only be highly commended and congratulated for the major achievement of launching its agenda, which is extremely well drafted, excellently structured, and utmost comprehensive, and which will greatly serve us all. Wishing all of us every success in deriving the right measures from this agenda and in triggering the political will to drive it, making the next success story in global health. Thank you so much for your kind attention.
Thank you very much. Thank you very much, Roland. I would like to pass the word now to Mariah McKimbrough. She's Art Director in Sepsis from the Sepsis Stiftung, and she's going to provide us with a sepsis survivor's testimonial.
Thank you very much. I was on stage all over the world about over 30 years. I also founded my own musical company and state-approved musical academy. In 2017, I changed my career with themes like tumors, lymphomas, depression, traumata. But I really thought I would come back really soon. After the first operation, I thought, now it's over. But I suddenly came back and had my first sepsis just a few weeks after I was discharged from the hospital. So it's good that I didn't know what was coming next, and from days were weeks, and weeks were months, and now years. The wounds in my body started infecting over and over and over again, so I had more than one sepsis, and it came to that shut down moment of a septic shock and coma. Yes, I never thought I would be in that position to be in my 40s and cannot walk anymore, I actually was in a wheelchair, cannot work anymore, be in pension, need to be cared for. So I had a lot of questions and I didn't find any answers until I found a Sepsis Stiftung. And I was amazed on one side about the hard work which is going on already, but I also was kind of like surprised, and it made me anxious to realize that I'm not alone with my story. There are so many, and it's so silent about it. I never knew that. So I thought, I need to do something. What can I do? And I used my prior career to make a little step in that direction. So I asked the Sepsis Stiftung to make a benefits concert. That was just a little small thought. But then I realized, no, it's more. It's just like, it's a starter. Sepsis needs the spotlight that it stole from my life. Now sepsis will get it. And I'm the art director now. I'm really honored that I'm having this opportunity. And with that opportunity, a new life. Sepsis is greedy and sepsis is expensive. So we need something against it. And to get it in the society, you need the heart, not only the numbers. So music can do exactly that. And that's why I'm here and giving my all with all of the world's actresses and singers, and they all on board. So we're starting now, and we started in June with the first one, and it was a success. Thank you.
Thank you so much for your presentation. And now we talked a lot about the 2030 Global Agenda for Sepsis, and it's my honor to introduce to you Dr. Mariam Jashi. She's CEO of the Global Sepsis Alliance and former president, I want to say, Minister and Deputy Minister of Health in Georgia, and it's great to have you here.
Thank you, Andrew. We are immensely grateful for your leadership and support in hosting this truly historic event for the global sepsis community. And we are grateful for the Unite Parliamentarians Network, to the Virchow Foundation for co-organizing the event at Bundestag. It's extremely difficult to cover this kind of high-volume publication in 10 minutes, but I will try my best to walk you through some of the key highlights of the document. First of all, as mentioned already by my esteemed colleagues, this is the first global multi-year strategy that was developed with engagement of more than 70 stakeholders. And the strategic planning dialogue started last year with the first sepsis side event on the margins of the UN General Assembly, the 2023 World Health Summit, and the World Health Assembly this year in Geneva. And we're especially grateful to The 6 co-organizers of the events, including Unite, Virchow Foundation, Clinton Health Access Initiative, the Global Antibiotic Research and Development Partnership, Medical Women's International Association, and Sepsis Stiftung. The discussions continued in consultations with engagement of multiple stakeholders across the 6 regional sepsis alliances, as already listed by Professor Ullmann. And as of today, even before the publication of the document, we have contributions and endorsements from 29 stakeholders globally. And we're especially grateful that the World Health Organization, the staff of WHO from headquarters and regional offices provided technical inputs to the document. The current document is built on the previous foundations laid by the historic 2017 World Health Assembly resolution. It also builds on the 2020 fundamental Global Sepsis Report led by the Institute of Health Metrics and Evaluation with the support and collaboration with GSA, and the WHO's first global report on epidemiology and burden of sepsis. G7 health ministers' communique also highlighted the importance of sepsis under the German presidency, and the Berlin Declaration last year was the concise roadmap on what should be prioritized in putting sepsis on the political agenda where it deserves to be. So even from this list, the prominent leadership of Germany is absolutely undoubtful, and we are extremely grateful that Germany will be supporting the global sepsis agenda further. As already mentioned, we're dealing with one of the major killers of children, women, and men worldwide. 48.9 million people affected every year, and with the latest estimates, more than 13 million lives lost to sepsis annually. Sepsis is the cause of 1 in every 5 deaths worldwide. And as already mentioned, the 85% of the global sepsis burden is affecting the low and middle income countries, and children are affected the most. But we have 2 paradoxes in the global sepsis response. One, the cause of every 5th death is not visible in the global health architecture and dialogue. And the second, those affected the most are least to be benefiting from action. While the low and middle income countries are suffering the most, we mostly see action, policies, and data from high income countries. And this is also very evident in the publication. We mainly have examples and success stories from high income countries. The Global Sepsis Agenda clearly highlights that without reinvigorated sepsis response, we would not be able to attain the health-related sustainable development goals. How we can progress against maternal, neonatal, or child health indicators if we do not tackle the major killer, especially in low and middle-income countries. And sepsis also is not only related to infectious diseases. More than 15 million cases of sepsis occur as the secondary complication of non-communicable diseases and injuries. So we still have a lot of misconceptions to overcome in understanding the challenge of sepsis. And sepsis is also related to 8 other sustainable development goals. Poverty is directly correlated with poor clinical outcomes of sepsis. Women are affected more than men. Sepsis fuels inequalities, especially in low-resource countries and in the low socioeconomic groups of high-income countries. So climate change, pandemic prevention, water and sanitation, they are all very closely interlinked to the success of the future sepsis response. The current document also highlights that while we are delighted as the global health and policymakers and experts that antimicrobial resistance is gaining historic momentum, unfortunately, very few politicians speak about the fact that almost 5 million annual deaths related to antimicrobial resistance are part of the 13 million sepsis-related deaths. This is another paradigm that we have to change, and we hope for stronger synergies of AMR and sepsis advocacy policy and interventions. The current document also brings together success stories from 15 countries, starting from Australia and Belgium to France, UK, and US, who have already developed national action plans and the evidence-based national policies, the so-called sepsis clinical pathways for adults and children. We also have additional 6 countries, including Germany, who has highlighted the sepsis and ensured nationwide advocacy and capacity building initiatives. But these countries represent less than 10% of the UN member states. Over 90% of the countries still have to take action against sepsis. And importantly, most of the success stories are led by the sepsis survivors and their families. And we owe them to all the changes that happened in the United States or Belgium or Netherlands. And yesterday, both Mariah and Professor Annane, who is joining us from France, we were attending the first Sepsis Patients European Forum in Paris that will issue the Paris Declaration as a call to action for the European leaders to invest in sepsis and invest in the continuum of care. Finally, the current document summarizes the economic case of sepsis. We still have to work on the investment case, but those are the data. On average, per capita direct medical cost per sepsis patient is over 36,000 euro. Sepsis costs 2.65% of the national healthcare budgets and 0.33% of the gross national products. And what we see from the countries who have already undertaken action is that, for example, in Australia, just the awareness-raising campaign and training of front-line workers resulted in 50% reduction of mortality in the hospitals and return of investments 1 to 6, like 6-fold return of financial investments. Canada, the British Columbia Sepsis Initiative, it was even more impressive. For every dollar invested, they documented $112 of return of investments, and overall, over $50 million have been saved in terms of averted deaths and disability only for the 4-year period. US has also documented saving 16,000 lives just through the New York State Initiative for Sepsis. And while data is extremely limited from low and middle income countries, we know, for example, from Vietnam, that sepsis cost 47% of sepsis patients and 56% of the families who lost their loved ones due to septic shock, impoverishing, catastrophic costs. Sepsis drew these families into poverty because of the high hospital-related costs. Based on the analysis of the burden, gaps, challenges, the current document is structured around 5 strategic pillars. And very briefly, let me highlight some of the key points of each of the strategic pillars. The first is definitely political leadership and multilateral collaboration. Without true and meaningful political ownership and leadership, we cannot make changes. And that is why we're asking for establishment of the high-level political platform for sepsis that will ensure integration of sepsis into the major mainstream of global health forums and development architecture. We are calling the countries, 80% of high-income countries and 50% of low and middle-income countries, to develop national action plans for sepsis, integrate them into the universal health coverage packages, and those documents can be standalone or part of the broader national health agendas. We have to synergize sepsis with the universal health coverage, maternal and neonatal health, antimicrobial resistance, infections prevention and control, healthy aging, and patient safety approaches. We need to create funding for sepsis. Sepsis is not only invisible, it's underfunded. We have to make sure that we have earmarked domestic budgetary resources for sepsis, as well as create official development assistance through donor governments, international financial institutions, and public-private partnerships, including innovative financing. And lastly, under the strategic pillar 1, we have to improve measurement and accountability. Our ambition is to establish regular data reporting, more reliable data through registries or ICD coding, and regular global sepsis reports to track progress. Under the second pillar, our major priority is establishment and implementation of the patient-focused sepsis clinical pathways, both for pediatric and adult patients, based on the experience of the United Kingdom, United States, Sweden, and other successful countries. We have to agree on the basic essential supply lists of equipment and commodities for sepsis management, and this should be also through the interagency coordination process. We have to focus on perinatal care, safe childbirth, especially for sub-Saharan Africa and South Asia, medical education and training, starting from undergraduate, similar to France's experience, to postgraduate, continuous medical education, and telemedicine initiatives run by Charité in Uganda and other countries. Those are the examples that you will all find in the document. And sepsis care cascades and quality improvement initiatives would be another important priority of the agenda. Whole of society approach, number 3 pillar, we really have to take the multi-sectoral and whole of society approach to sepsis, starting with understanding in the communities that, for example, vaccination is a strategic prevention measure for sepsis. We have to ensure that at least 80% of communities understand that sepsis is a medical emergency like stroke or heart attack and requires immediate care-seeking behavior. We have to engage more countries in World Sepsis Day events with media and public opinion leaders, and we have to work very closely with patients' communities for patient care continuum in the communities through community pathways, as well as special focus on post-sepsis care and rehabilitation. No one speaks, no one funds, no one supports the post-sepsis care for our survivors. Number 4 is the sepsis research and innovation agenda, and here we speak about investing in sepsis science, both public and private investments. Similar to the BARDA experience in US, or the recent experience of Germany's support to the 7 sub-Saharan African research project on sepsis. Those are excellent examples, but we need more. We need critical support to the sepsis science, especially in low and middle income countries. And we have to promote the knowledge hubs, similar to the Sepsis Info Center run by the Sepsis-Stiftung, or George Institute for Global Health in Australia, or the Sepsis Alliance Institute in the United States. More importantly, we have to work jointly as a platform of patients, researchers, and innovators to establish the Global Sepsis Innovation Partnership, the platform. And we will be building on the experience of the US Sepsis Alliance that was originally supported by FDA, the Food and Drug Administration of the US government. And we will be bringing together discussions on unmet needs and priorities, both for novel prevention, like vaccines, especially against the pathogens that are primarily causing sepsis, diagnostics, including biomarkers, molecular diagnostics, and point-of-care commodities, therapies, antimicrobial, not only antibiotic, antiviral, antifungal, antimalarial, because sepsis is the common pathway to death from all possible infections. Immunomodulatory therapies should be also prioritized, as well as precision medicine because of the heterogeneity of the sepsis origins. Artificial intelligence tools for early detection and management are promising, but we need better specificity and sensitivity of those tools, and post-sepsis care and rehabilitation commodities. prosthetic care, for example, for our patients still remains a major challenge. So this platform that GSA will be co-funding or co-convening with the US Sepsis Alliance and Sepsis Stiftung will bring together the discussions on the unmet needs and support collaboration between innovators and researchers. The final strategic pillar talks about the emergencies. Almost 80%, more precisely 78% of the ICU patients due to COVID-19 had viral sepsis, and yet we never speak about that. And any future pandemic will lead to increased infections, incidence, and increased risks of sepsis. So we have to integrate sepsis in the pandemic accord and the national pandemic preparedness plans. With 120 armed conflicts and more than 360 million people in humanitarian crisis under the increased risk of sepsis, we have to integrate sepsis response in the humanitarian guidelines and protocols, both for civilians and military. And climate change is also clearly indicated with increased risk of infections. We do not provide any investment case because we need to work more partners, including WHO, OECD, research institutions, to really come up with the convincing investment case. But even based on the goals of this current document that targets 25% reduction in incidence and 20% reduction in mortality, we're speaking about reducing sepsis cases by 12 million by 2030 and saving at least 2.2 million lives every year by 2030 versus the current baseline. So, of course, this is an ambitious document, but I think this is truly a historic moment for us to ensure that through multi-sectoral engagement and leadership, we will be able to make a breakthrough that is so much needed for sepsis, and we truly will be able to save millions of lives. Thank you.
Mariam, thank you very much. I think it's really challenging to really briefly introduce the 2030 agenda on sepsis. And I think you did a great job, and thank you for that. And I think everybody's now very curious is going to read this booklet. I think it's very important, especially for the political agenda. We're continuing now with so-called interventions and general discussion. And the first speaker that we have here on the list is Dr. Heinz-Henri Kluge. He's Regional Director for Europe, WHO. He has a video address.
Sehr geehrte Kolleginnen und Kollegen, vielen Dank für die Gelegenheit, heute zu Ihnen sprechen zu können. Sie haben von der Bedrohung gehört, die die Sepsis weltweit für die Gesundheit darstellt. Werfen wir nun einen kurzen Blick auf die Situation in Europa. In der europäischen Region der WHO sind Jahr für Jahr etwa 3 Millionen Menschen betroffen. Fast 7000 Menschen verlieren unnötigerweise ihr Leben. Von Sepsis sind Frauen, Kinder, Senioren und Menschen mit chronischen Erkrankungen unverhältnismäßig stark betroffen. Sie ist eine ernste Bedrohung für die öffentliche Gesundheit. Doch, und das ist ehrlich gesagt erschreckend, in vielen europäischen Ländern steht die Sepsis-Problematik immer noch nicht weit genug oben auf der Tagesordnung. So haben nur wenige Länder die 2017 von der Weltgesundheitsversammlung verabschiedete Resolution zum Thema Sepsis vollständig umgesetzt. Das muss sich dringend ändern. Unser Aktionsplan ist die globale Sepsis-Agenda 2030. WHO Europa befürwortet uneingeschränkt ihre 5 Schlüsselbereiche. Handlungsbereitschaft der Gesundheitssysteme, Einbeziehung der Bevölkerung, Forschung und Innovation, bessere Vorbereitung auf Pandemien und Notlagen sowie als grundlegende Voraussetzung Führung durch die Politik. Vor kurzem hat WHO Europa in Griechenland ein Fachzentrum angerichtet, das auf eine Verbesserung der Versorgungsqualität und Patientensicherheit in der gesamten europäischen Region hinarbeiten soll. Dies ist ein entscheidender Schritt nach vorn, damit unsere Gesundheitssysteme in der Lage sind, Sepsis wirksam zu verhindern, zu erkennen und zu behandeln. Und es wird auch anderen Ländern in der europäischen Region als Vorbild zur Nachahmung dienen. Sehr geehrte Kolleginnen und Kollegen, die Covid-Pandemie hat uns schmerzhaft vor Augen geführt, wie unvorbereitet unsere Gesundheitssysteme sein können. Die globale Sepsis-Agenda 2030 wird dazu beitragen, dass wir besser auf den Schutz besonders gefährdeter Menschen vorbereitet sind. Es liegt auf der Hand. Zur Verringerung der Zahl der Sepsisfälle ist eine gemeinsame Anstrengung erforderlich. Deshalb appelliere ich dringend an die Regierungen und ihre Gesundheitsministerien, an die Gesundheitsberufe, an Wissenschaft und Gesellschaft, hier an einem Strang zu ziehen. Vor allem müssen wir dafür sorgen, dass Sepsis-Überlebende und die Familien, die Angehörige verloren haben, am selben Tisch sitzen. Ihre Erfahrungen müssen uns den Weg weisen. Zusammen mit meinem Team bei WHO Europa stehe ich bereit, Sie in Ihren Bemühungen zu unterstützen. Ich danke Ihnen.
But you saw the English subtitles. Now I'd like to invite my esteemed colleagues from the German Bundestag, from the democratic middle, as we like to call ourselves, who wants to bring up a statement. This is on a voluntary basis. I don't want to put you on the stand, but who wants to say anything? I'm looking here to my left, if somebody wants to. Okay, I don't see anybody. I would like to just make one. Very, very good. I like being that parliamentarians are impressed. But I do like to want to bring up one point which I think is important in a dual situation that I am in. I'm not only a politician, I'm also a physician trained in infectious diseases. And I think it's very important that not only the political leadership is important, not only, and I'm very happy to see that industry is here as well, sitting on this round table. I think it's also very important that the healthcare professionals understand sepsis, and this is something very important for the teaching facilities at the university, not only for physicians, but also in nursing care, but in every aspect of life. And it includes also education at school, that it is understanding if somebody gets hurt and he has a broken bone, it's obvious, you can see it. But sepsis has very subtle starts of symptoms that has to be understood, and it could start off in first aid courses that here in Germany we have as a mandatory course before you get your driver's license. So all these issues is very important. I couldn't more agree with Dr. Kluge, who just said that all versions of life are very important to understand sepsis, and that sepsis can only be cured if it's treated on time. Walking behind the wave, as we like to call it, it's too late, or for most patients too late, and that's why it's so important. And I'm glad to be a part of this here in the German Bundestag in my dual role as a physician, a teaching physician, and politician. That said, I'm looking at my colleagues. No further comments so far, so I hope I spoke on your behalf as well, even if it's the governmenting coalition that's sitting here and the largest opposition party sitting here as well. Thank you very much. I'd like to move on to Dr. Rudi Eggers. He is Director of Integrated Health Services at the WHO, and I'd like to pass the word to you.
Sehr geehrte Damen und Herren, guten Tag allerseits und herzlichen Dank für diese Einladung vom Deutschen Bundestag und dem Global Sepsis Alliance. Zunächst möchte ich den verehrten Mitgliedern vom Bundestag hier danken, insbesondere Professor Ullmann, der Vorsitzende des Subkomitees für globale Gesundheit im Bundestag. But I would also like to recognize our international partners, specifically the Global Sepsis Alliance, Mariam Jashi, Tex Kisun and Professor Reinhart. We would also like to recognize the United Parliamentarians Network for Global Health, the Virchow Foundation and the Sepsis Stiftung, and then very importantly, all those representatives and sepsis stakeholders, be they families, patients, public institutions, academia, private sector and industry, and members of the civil society. As Director of Integrated Health Services at the World Health Organization, we greatly appreciate the work that has been done by the Global Sepsis Alliance in accomplishing this development of this agenda, thereby catalyzing critical action to move forward both globally and at country level. We also acknowledge the German government's important leadership regarding the awareness and political prioritization of sepsis globally. Specifically, the German government was the leading country promoting the sepsis resolution, which was adopted in the World Health Assembly in 2017, an unprecedented milestone in the history of the fight against sepsis, enabling many critical actions in the international and national level. This achievement was realized thanks to the German government's engagement through the Global Health Subcommittee, collaboration with the United Parliamentarians Network for Global Health, which continues to contribute to the implementation of the resolution worldwide. Die WHO ist der Bundesregierung außerordentlich dankbar für ihren früheren finanziellen Beitrag, der unsere Arbeit zur Sepsis über mehrere Jahre unterstützt hat, beispielsweise für die Erstellung des 2020 veröffentlichten Global Report on Epidemiology and Burden of Sepsis, der von entscheidender Bedeutung war. Dieser Bericht veranschaulicht die Auswirkungen der Sepsis auf die öffentliche Gesundheit, hebt bestimmte Bevölkerungsgruppen und Personen hervor, die medizinische Versorgung suchen, und schlägt Richtungen und Prioritäten in der epidemiologischen Sepsisforschung vor. Der Bericht bietet eine Grundlage zur Messung der globalen Arbeit, auf die sich die WHO und andere Organisationen heute noch konzentrieren. We also note and value the Global Sepsis Alliance continued meaningful collaboration in the WHO Global Sepsis Coordination Group, which focuses on local and regional work to enact action aligned with the World Health Assembly resolution. Within WHO, recent examples of our work in sepsis include the development of a guideline for the clinical management of sepsis and bloodstream infections, which give healthcare workers direction in terms of diagnosis and treatment, be it at a specialized clinic in Europe or be it at a health post in a remote area of a low-income country. A second example of WHO's work on sepsis include a large set of training tools supporting the delivery of patient-centered care for sepsis patients, contributing to the better management of sepsis patients. The WHO Global Action Plan on Infection Prevention and Control and the IPC Monitoring Framework was recently adopted in the World Health Assembly in May 2024 and provides the regions and countries with a tangible platform from which to leverage political and financial support, which will impact the prevention of infection in all healthcare settings and globally. So I take this special opportunity to congratulate the Global Sepsis Alliance on the launch of the 2030 Global Agenda for Sepsis, as well as their continued efforts to advocate and prioritize sepsis politically with the goal of reducing the burden of sepsis worldwide. Again, my sincere thanks for this invitation to speak at this important event. Herzlichen Dank.
So using the tool of dual language, Dankeschön for those very nice words. I think that everybody understood very nicely. I'd like to pass the word now over to Professor Dr. Axel Pries. He is the president of the World Health Summit, which will take place here in Berlin again in about 4 weeks. For now, I think even exactly in 4 weeks. 5?
I think so, yeah.
Okay, I will look it up.
Yeah.
But the stage is yours.
But prepare in 4 weeks. Yeah.
Okay.
Thank you very much, Professor Ullmann, and thank you very much for the invitation. And I'm really overwhelmed by the strength of the initiatives from the Sepsis Alliance and supported by Unite and the Virchow Foundation and the Sepsis Stiftung. And it's a little bit puzzling when you hear these numbers, both the threat and also the options. Then it's really puzzling why we are in such a situation. Because if you have a threat like an asteroid coming to the Earth and you know the threat is big, but you can't do anything, okay, you go to sleep. But here we have options. And the third pillar is it's even economically sound. We heard that investment in sepsis is, the return on investment is very high. So if you ask any intelligent system people or AI what should happen in this situation, it's very obvious. It's a no-brainer, if I may say so. But it's not. And your report and the reality, when I first was alerted by Konrad on the topic, I was looking back to my education as a physician, and I had to say, yes, it's under the radar. There is no, if you go through Charité campus, there is no the sepsis clinic. And I was asking, what is the biggest conference? I'm from the cardiology field. They just had their conference in Europe with 30,000 people there and a lot of industry and a lot of effort. So we have to go from the pathophysiology, which is clear, the economics, which is clear, the epidemiology, which is clear, to the psychology, which seems to... What is the reason that we don't take this opportunity? Probably human psychology works in a way where you need something which you can grapple. You were talking about a broken leg, and that's easy to see, or cardiac is easy to see, and cancer is a threat everyone is frightful of, and dementia. But sepsis seems to be, not really the psychological threat which it is. And I don't know the answer how to change that, but I think it was said here that we have to work together. We have to work from the patient and family side, which is probably in this situation the best driver, because it's a most realistic information we have. But then we have to have the doctors, we have to have the health systems, we have to have academia. As far as I know, there are, I was in the Biomed Alliance in Europe, which is the umbrella organization for the medical subspecialties or specialties. And yes, there's neuro, there's cardiac, there's cancer, there's surgery, there's even heart surgery, there's even bone surgery, and so on. You go down, and they are all very strong and visible, but it's between the cracks. It's somehow not a very well visible entity. And so we need academia, industry, societies. And in this situation, I think and that was said before, the best chance to put it together is in politics, because politics can give the right stimuli to these other groups, like asking the academia and the medical system to install specialties here, something like that. And because it seems that the grassroots activity, the autonomous development doesn't really fulfill the job, especially in such an obvious no-brainer case. And therefore, I guess here we need a little bit of top-down intervention by politics, and I hope that this is a good event to start that. Thank you very much.
Thank you, Axel Pries. And there's a lot more things that we could, of course, discuss. I'd like to pass the word now on Professor Djillali, I hope I pronounced it right, Annane. He's Dean of the Faculty of Medicine at the University of Versailles in Paris and also head of the Critical Care Department.
Thank you. Good afternoon, everyone. So I would like to make 3 brief comments here. The first one is to highlight that it is of the utmost importance to listen to those who have experienced sepsis. Yesterday in Paris, there was the first EU Patients and Families Summit to fight against sepsis. And what I repeatedly heard yesterday from these patients and families is, first, I didn't think I can get sepsis. I never heard about sepsis before. And when I got sick and called my doctor, he never took me seriously. What that highlights, it highlights a poor level of education of the public and also of the healthcare physicians. So that unknown killer, which is sepsis, really is doing a lot of damage in our societies in silence. The second comment is, I'm a strong believer in Europe. And I think that the European Union has a major role to play here, but unfortunately is missing the opportunity to take the lead in fighting against sepsis. Why I'm saying this? After the pandemic, European Union decided very wisely to revise, to revisit ECDC, to make plans, to be able to be more prepared for the next threats. Believe it or not, in the agenda of ECDC, sepsis word is even not mentioned.
Even now.
Okay, so how can we make progresses in that fight if at the European level there is no plan for surveillance? So making clear that we all know how many people get sepsis before we want to tackle the disease. Believe it or not, there is absolutely no educational curricula in medical school around Europe for medical students to learn about sepsis. Yes, now it is implemented in France, but just this year.
That's also Germany.
So how do you want that my colleagues in the field of cardiology, in the field of neurology, of emergency, outside the infectious disease and ICU, physicians know about sepsis? They never learned about it during in the medical school. And finally, the European Union must promote education also in low and middle income countries. That is a responsibility for EU to do this and to promote academic and private research. But here again, you surely all know about Horizon Europe, the billions and billions of money rightly invested to promote research and innovation in Europe. There is thousands of pages for the call. The word sepsis is never mentioned. You see how big is the problem here? And my final comment is, yes, it is why it is important to take this seriously, because it's cost efficient. It's not only saving life, but it's saving life in good health. And this is obviously very important because you avoid people that could not get back to work. And you also avoid the burden of taking care of disabled people. So it's really cost efficient to fight against sepsis. And I think that we all can get sepsis. Me, you, it's hardly to predict, but we all can get sepsis. European Union must be the solution. And I think that Germany is likely in a very good position to take the lead and make things changing in Europe. There's not that much to do for you. It's only a small step for you, but a big one for Europe and the rest of the world. Thank you.
Thank you so much.
Thank you very much. I have to disappoint you in one point. At least in Germany, there are a couple of universities that do teach sepsis. And I could assure you I did this lecture as the professor for infectious disease in our university hospital. So I wanted to say that it was prior to COVID. But I totally agree with you. There is a challenge that sepsis is not really recognized. I share the experience with Axel Pries that when we went through medical school, there was no mention of sepsis. It was just happens. Okay, I would like to open up the floor. If anybody wants to, we have time for one or two statements. If anybody wants to say anything in regards to sepsis, I like to broaden the discussion room here. Is anybody who wants to be an icebreaker, or does anybody want to comment, please? And introduce yourself, please.
So, yeah, perfect. So, yeah, my name is Guido Schütte, and I'm working for Siemens Healthineers, and I'm here also in maybe not two, maybe three roles. First of all, of course, as a representative for Siemens Healthineers, where also we work for and against sepsis, and we want to pioneer breakthrough in healthcare for everywhere and everyone. But in addition, also as a medical doctor, I'm here. And the third topic is that also my mother was diagnosed with sepsis. So I think it's really important to work together here, to collaborative between really politicians, between different other companies, and therefore I'm really thankful to be here and to be part of the official launch event of the 2030 Global Agenda for Sepsis. And I think you have shown the importance of this topic. So thank you for that.
I cannot read the, I only see Alexander as your first name, sorry.
Thank you. Thank you for being part of this. My name is Alexander Trifunovic, and I'm also in a dual role, so to speak. I'm representing Roche here, but I was also a sepsis patient. I was born 35 years ago in Belgrade, and as a newborn, 7 days, I got an infection with Staphylococcus aureus. I got a bone infection. It was eating basically my bone, and I developed a severe sepsis, and I survived. But how did I survive? I survived because I had luck. There was the right physician at the proper time who diagnosed what was wrong and who could immediately act. And besides some small disfigures, I don't have any disabilities. But this was 35 years ago. And look at what we have achieved with HIV. I like the example of Freddie Mercury, great artist, died from HIV, where we didn't have any cure 35 years ago. And what we could achieve in the future. And thank you for launching this agenda on sepsis, because I would like to have small children not to survive based on luck, but of a certain certainty that there is awareness and there's a cure. So thank you for your work.
Please go ahead.
I just like to, is it on? I'm Jessie Gu from Novartis. I'm a global program head for a novel drug discovery development program. We have at Novartis for sepsis and sepsis-associated organ injuries. So the first organ we're tackling right now is acute kidney injury, and our program is in a global phase 2B development. Hopefully, we'll advance it all the way through for these patients who are in huge unmet medical need. So I would like to say that I'm from the US. We recently had a conference where the FDA actually spoke at the conference about integrating patient-centric approaches and patient input into the drug development programs. And in this program, we have the opportunity to really, take what matters to patients most and their families most into this novel discovery program. So thank you again, GSA, for the invitation. I'm really thrilled to be here.
Then I see Dr. Vollert from Thermo Fisher.
Dr. Jan-Ole Vollert, Medical Director from Thermo Fisher. First of all, I want to say thank you for all, Konrad. What you have done in your life is really one of the greatest examples of leadership I've ever seen. So please keep on going with Mariam, Professor Pries, and all the others. You achieved a lot, but I want to say one thing. Don't go in competition, because I'm one of the 30,000 coming from London right now from the cardiology convention, because I'm cardiologist from my training. And I told this Konrad again, it has to come intrinsically out of the doctors. It has to come positively. It has to come out of the relatives. Everybody knows somebody who died at heart attack, and not everybody knows somebody who died at sepsis in the relatives, in the family fields. Yeah? And so this has to change, and it can only come, the change, what you said, from the youth, from the young doctors who are confronted with this and intrinsically promoting this topic. And don't make a competition against heart attack or others. Yeah, they are all diseases. They are all severe, and sepsis has its own field, and it has to come out of the people, out of the medical training and the doctors. Thanks.
Oh, sorry, I can see your hand. Please go ahead.
Thank you, and thank you everyone for being here. Thank you to Professor Reinhart. Thank you, Professor Ullmann. Thank you, Mariam, for having us here today. I'm Stacey Orsa. We all, as we mentioned, carry many hats. I've come here from the Patient Safety Movement Foundation meeting that was recently held in the US, and I'm reminded often at a meeting of the importance of action. And I find as an individual, I don't find my way to action, but I would like to suggest that as industry, we meet at the end of this meeting, and we decide as industry to come together to form the declaration under the Berlin Declaration for Sepsis, what industry will work on together. I think we're overdue as industry to collaborate on this non-partisan, non-competition subject. It's difficult. I apologize, I speak fast as a Canadian. It is difficult to find the why we don't act. And part of the why we don't act, I think, is because it's difficult to find where the common link is on action of cost benefit. Maybe we'll never find it, but we know that the benefits to our society, and as was said, we will all be victims or survivors of sepsis at some point if we don't act. So I'd like to ask everybody that's on the industry side to meet at the end of the meeting, and let's form an action committee so between us we can find the action point forward. Secondly, I'd like to suggest, as a kid, for me, ABCs was what I learned in my action plan of saving a life. ABCs, airway, breathing, circulation. I'd like to suggest the S is sepsis. For English countries, that makes sense. I don't know how that makes sense in other countries. But for me, simple acronyms drive change across all levels of education. And I've been thinking through how, even in a town of 1,000 people, how S becomes think airway, think breathing, think circulation, think sepsis. It's heartbreaking to think that right now, families like the family we learned about at the Patient Safety Summit, Rory's family, are dealing with a loss that they can't find their way forward of how to save lives. So thank you, all of you, for what you do to encourage me that I need to form a network of where I can create action. And thanks to all of you on industry to consider meeting perhaps in the hallway afterwards to form an action committee so we can make a difference.
Okay, then please go ahead. Sorry.
So thank you all from industry for these comments. And it's very encouraging. And I want to let you know, because also I may say, the first ombudsman for sepsis in Germany who I was impressed for. And it's Dr. Stefan Schulze, an MDB here. And he is the one who was very willing to organize 2 years ago a public event here in the Bundestag where 60 to 70 MDBs from different parties had a picture, not a picture, but a script on it related to sepsis. This was another encouraging step. And in addition, I also have to say, because we talked a lot about Germany, and it had a crucial role with ups and downs, but one thing what also happened was that we were funded to do more research in this field, in various areas, also on how to transport awareness into the public and also in the healthcare system. It's difficult and it needs a lot of investment. But what we were able to do and to develop is a sepsis checklist, which is now digitalized, and we will launch it jointly if MDB Schwarze agrees, because you have it now on your tablet or on your foot. And it's about, am I at risk? It's about, have I any suspicion for infection? And it's, which is foremost important, signs of emergency. And it advises to get contact and ask, could it be sepsis? So we don't need to start from the very scratch after all these decades, and we need help. Only over the last weeks, I got several phone calls who have already looked into this checklist, and they have questions, and we need to be able to respond to it. And we as a foundation need this support, which is publicly funded in UK. So Jeremy Hunt, one thing when Melissa Maid came to him was that sepsis needs to become a priority, and they have a 24/7 hotline. And what we are asking for jointly with Mariah, because we need to establish this until next year's World Sepsis Day, 1 million, which will allow us not only to go along with this Sepsis Mum project, which she is asking support for, but also to provide a 24/7 hotline for all those who think in the same way. So that's with this. I just to encourage us, we don't need to start from the scratch. There's so much, and we have not a problem with resources. There's no country who has more ICU beds than the European countries and hospital beds, etc., etc. We just need to get it done, to implement what we know, to bring knowledge to practice.
So, dear colleagues, friends, we couldn't ask for a better launch of the 2030 Global Agenda for Sepsis. We're extremely grateful for your interest and participation, and for reaffirming that this is the right way to go. And we look forward to operationalizing the high-level political platform for sepsis, and I'm sure Unite Parliamentarians Network through the support of our dear colleague and friend Ricardo Baptista Leite. We soon will plan, I hope, a visit to the European Parliament to start convincing our colleagues, since EU definitely will have an important role to play. We look forward to establishing and operationalizing the Global Sepsis Innovation Platform as the public-private partnerships and the Global Patients Group for Sepsis as the concrete next steps for moving this discussion into concrete actions. And I just wanted to highlight two important issues. Later this week, United States will be submitting sepsis bill to the Senate. And that's thanks to the unwavering advocacy from Rory Staunton's family, Ciaran and Orlane, who have really done an amazing work and have saved thousands of others' lives. We hope the sepsis bill will be successful and can pave the way to other countries to learn from the political perspective. And as already mentioned by our colleague from Roche as a sepsis survivor, indeed, we have amazing success stories, immunization, HIV, malaria, and we really hope to make this as the next success story. That's why we highlight it even on the cover of the 2030 agenda. And it's very realistic. It really needs to consolidate the knowledge we have and to ensure that we create critically important resource investments, not only financial, technical and human resources to overcome the challenges. Thank you very much, and I look forward to our continuous collaboration. Thanks.
So as we come to a close to today's event, I would like to take a moment to reflect on the important discussions we had and the commitments that have been made in the fight against sepsis. It is clear that sepsis remains one of the most significant yet under-recognized global health threats, affecting millions of lives and causing an enormous toll on health systems worldwide. The launch of the 2030 Agenda for Sepsis marks a critical step forward in addressing the crisis. But this agenda is only as strong as the actions we take from here on. It is up to us whether we present governments, international organizations, the healthcare sector, or civil society. It is up to us to ensure that the commitments made are translated in tangible progress. Let today be the catalyst for action. The road ahead is challenging. However, with a collective effort, we can save millions of lives and move closer to achieving our shared goal of global health for all by 2030. Thank you once again for your participation and commitment and your passion. Let us continue to work together to make a real and lasting impact. I also would like to say a word of thanks to for those who organized this meeting today. And I would like to also say thank you to also my team and your team, especially Bettina Brzo, who's sitting in the back.
Marvin,
and exactly, all those names. I could, just without them, this meeting would have not been a success.
Absolutely.
So thank you very much for your. So, very final last words. I would like to ask you to stay a little bit so we could take a group picture together with the booklet of our 2030 Global Agenda for Sepsis. And for those who don't want to be on the picture, it's also fine. Be aware those pictures are put on social media. And otherwise, I would like to wish you all a very great evening here in Berlin. For those who do not come from Berlin, enjoy this day. We are lucky with the weather today. It was a different forecast originally. And again, thank you for your coming.
so happy everything was out without talking with each other. It's kind of a it was also fun and so much. I mean, this topic and panel were the most. I don't know any other person who was working more hard than you. But no, it's also a shame. It used to be fun and it's also so much to achieve.